Nurse Radio Podcasts.
Welcome to the APRN Pipeline Podcast with Professor Garcia.
Welcome back to the APRN Pipeline. I am your host, Professor Garcia. We are moving steadily past the halfway point of our journey up the mountain. In our last episode, we mastered the search for evidence and discussed the vital importance of appraising the evidence. But guess what? Evidence alone doesn't change practice. Today, in episode 4, we are moving from the what to the how. We're going to pick up where we left off and discuss the heart of quality care, the patient perspective. Then we're going to dive into the advanced quality improvement competencies needed to measure our success. And finally, we're going to tackle the leadership challenge of implementation. Today, we're covering leading evidence-based practice and quality improvement initiatives in advanced nursing practice by editors Waldrop and Dunlap. Let's get started. Nurse Radio Podcasts. It's easy to get lost in the data. Let's paint a picture of evidence-based practice as a three-legged stool, with those legs comprising the best evidence, our clinical expertise, and patient preferences and values. Let's look at the literature. In the chapter by Walters and Waldrop, entitled Incorporating the Patient Perspective in Quality Care from 2026, they state personalizing healthcare interventions is essential to evidence-based practice. It ensures that healthcare delivery is scientifically sound and attuned to patients' needs. Let's recall our flu vaccination initiative and our PPCO question from our previous episodes. Our population was adults. Our problem was low flu vaccination. Our change was a standing order protocol, and our outcome was vaccination rates. We also looked at the qualitative evidence to help us understand why patients might be hesitant about a flu vaccine. And without that understanding, our protocol will fail. Going back to the same chapter and authors, they state studies indicate that patients who are actively involved in their care decisions have better adherence to treatment plans, experience less anxiety, and report higher satisfaction. As APRN leaders, we can use what's called shared decision making and therapeutic communication to bridge this gap. We don't just tell the patient they need a shot. We listen to their fears about side effects or cultural beliefs and incorporate that into the care plan. This promotes equity by ensuring that patients from all backgrounds receive culturally sensitive care. If this is important to you, then I encourage you to go back to episode 2. In that episode, we applied the STEEP framework to our vaccination initiative. We asked ourselves 3 questions on effectiveness, equity, and efficiency. We asked, are we using the best evidence-based guidelines for who should get the shot? Are our Spanish-speaking patients getting vaccinated at the same rate as our English-speaking patients? And we examined whether the nurse's workflow is so clunky that we miss asking about the vaccine because we're just too busy. Let me know what you think about the role of the patient's voice in your project. Post a comment below on how you will specifically elicit patient preferences to ensure your evidence-based practice quality improvement initiative is truly patient-centered. Let's keep going. Nurse Radio Podcasts. Okay, I have a question. How do we know if our vaccine initiative is actually working? We don't wait 6 months and just look at a single number. We use the science of quality improvement. In the chapter entitled Advanced Quality Improvement Competencies from 2026 by Reynolds, they state quality improvement is a data-driven, problem-solving approach that seeks to improve workflow processes that are specific to the local area. To do this, we need a family of measures. These are outcome measures, process measures, and balancing measures. Let's recall our flu vaccination initiative. The outcome measure would be the actual flu vaccination rate. The process measure would be Are the nurses actually following the standing order protocol, meaning percent of eligible patients identified? The balancing measure would be, did our new protocol increase patient wait times or decrease satisfaction? We want to ensure we aren't fixing one thing while breaking another. Next, we track these data using run charts. These are simple line graphs that show our progress over time. From the same chapter, Advanced Quality Improvement Competencies, they state a run chart is easy to construct and simple to interpret and provides a visual tool that allows the team to learn about the change process. Here, we look for signals of improvement. This can be a shift, like 6 or more consecutive points above or below the median, or a trend, like 5 or more consecutive points, all going up or down. If our vaccination rates show a trend upward over 5 weeks, we know our change is working. Does this make sense? Let me know what you think about using run charts versus traditional statistics. Post a comment below on what your balancing measure might be for your own evidence-based practice quality improvement initiatives to ensure no unintended negative consequences might occur. Let's keep going. Nurse Radio Podcasts. So what does it mean to lead implementation? Okay, so by now you should have the evidence and the measurement plan. Next, you have to lead the change. This is what the textbook calls implementation science. Let's look closer. According to the authors Waldrop and Dunlap, from the chapter entitled Leading Evidence-Based Practice Quality Improvement Implementation from 2026, they state, implementation science is the study of the practices used in implementing practice changes. It offers strategies you can use to increase the success of your endeavors because multiple strategies are generally required. Remember, first, we must protect our patients. Most evidence-based practice quality improvement projects are what's called non-human subject research because they use existing evidence to solve a local problem rather than seeking to generate generalizable knowledge. However, as an APRN leader, you must still verify this with your institutional review board. Okay, so what about buy-in? To do this, the authors talk about what's called a SWOT analysis. This stands for strengths, weaknesses, opportunities, threats. Looking back at our vaccination project, the strength would be support from the clinic's administration. The weakness might be some providers are resistant to change. The opportunity would be potentially presenting our results at a conference. The threat might be staffing shortages in the clinic. Now, to pilot your change, you can use PDSA cycles. Remember? Plan, do, study, act. Maybe you can start with just one provider or nurse team for a week to see if your project works before rolling it out to the whole clinic. Okay, I know it's a lot. Let me know what you think about the implementation changes you anticipate for your project. Post a comment below about one barrier you've identified in your clinical setting and which facilitator you will use to overcome it in your evidence-based practice quality improvement initiatives. Wrapping up, Nurse Radio Podcasts. Today we've covered the how of your practice improvement project. We've learned that the patient perspective is the heart of evidence-based practice, and that run charts and families of measures are the eyes that let us see our progress. Also, that implementation is a strategic leadership act that requires buy-in and iterative testing. We applied this to our flu vaccine project, which is now ready for the real world. We've designed it with the patient in mind and have our run charts ready to plot our first data points. Also, we've identified our champions to help us navigate the SWOT analysis specific to our clinic. On our next episode, we will reach the peak of the mountain. We will cover the evaluation of evidence-based practice quality improvement initiatives, discuss how to disseminate your findings through publication and presentation, and finally, we'll connect all of this hard work to your future as an APRN leader. Signing off, I am Professor Garcia, and this has been episode 4 of the APRN Pipeline. Keep questioning, keep searching, and keep improving.